Acetaminophen, better known as Tylenol, Katrina Hill, C. Lore, and Correlia Valencia. Acetaminophen is used to treat mild to moderate pain from headaches, muscle aches, menstrual periods, colds, sore throats, toothaches, backaches, and it helps reduce fever. Acetaminophen is also used to relieve pain from osteoarthritis. As with any drugs, read the label before using acetaminophen and follow exactly as directed on the prescription or package label. Molecular structure and Iupac name. The molecular structure is C8H9NO2. The Iupac name is N,4-hydroxyphenolacetamide. The physical properties of acetaminophen are it's colorless to white crystalline solid, it's odorless and has a bitter taste. The density is 1.293 grams over milliliters to the -1. The melting point is 168 degrees Celsius and the boiling point is 420 degrees Celsius. The functional groups of acetaminophen are the hydroxyl group, which is circled in red, the amide group, which is circled in blue, the benzene ring is circled in orange, and the phenol group consists of the hydroxyl group and the benzene ring. The history of acetaminophen is it started out as aspirin, which was first synthesized in 1853 from vinegar and salicylic acid. It's a bitter chemical found in willow bark and leaves that the ancient Greeks and other people around the world knew about. Bayer marketed aspirin in 1898, but the side effects were bleeding ulcers. So acetaminophen was introduced in 1955 as an alternative to aspirin. This over-the-counter drug relieved mild to moderate pain without the stomach irritant. Acetaminophen is synthesized by using P-aminophenol, also known as Tylenol. P-aminophenol contains impurities that needs to be removed. Norite and water can be used to remove these impurities. First, the water-insoluble amine must be converted into amine hydrochloride to become water-soluble. With the addition of a sodium acetate buffer and an acylating reagent, the amine hydrochloride is completely neutralized, which lets the amine group bond with acetic anhydride. Mode of action. Acetaminophen is categorized along with nonsteroidal anti-inflammatory drugs, or COX inhibitors. Acetaminophen inhibits COX pathways in the central nervous system. The reduction of COX pathway activity by acetaminophen is thought to inhibit the synthesis of prostaglandins in the central nervous system, leading it to its analgesic and antipyretic effects. Prostaglandins are a group of lipids made at the sites of tissue damage or infection, which have a variety of inflammatory effects. Pharmacology. They are a group of drugs of diverse chemical structure and physiological effects that are used for the relief of pain. The drug must selectively reduce or abolish pain without causing impairment of consciousness, mental confusion, incoordination, or paralysis, or other derangements of the nervous system. The drug also blocks the synthesis of prostaglandins in the inflamed tissues, thereby prevents the sensitization of pain receptors. It also acts in some obscure way in the hypothalamus and also reduces fever and prevents platelet agglutination. Case study. A study after another confirms the possibility of behavioral, learning, and health problems in children whose mothers use this over-the-counter medication. Recently, 14,000 children with hyperactivity, attention deficits, and behavioral issues were studied. Initially, this serious side effect occurred for both boys and girls, but by the time the kids were finishing primary school, boys' behaviors were more affected than the girls. Case study number 2. According to Dr. William Shaw, acetaminophen used by pregnant women and vulnerable young children is a major risk factor for autism. Acetaminophen toxicity may cause autism by overloading the defective sulfation pathway catalyzed by phenylsulfotransferase, which is a deficient in autism, resulting in an excess of the toxic metabolite N-acetyl-P-benzoquinone amine, or NAPQI. Increased NAPQI levels reduce the ability to detoxify toxic chemicals in the environment. increasing oxidative stress and causing free radical damage to proteins, lipids, and nucleic acids. Autism now affects 1 in every 50 people in the United States. Dr. Shaw has issued a call to action to end the use of drug in children under the age of 3.